I wanted to talk about something that's very important in running a dental practice. Everybody talks about it. And when I first heard it, I don't think I fully understood what they were talking about. And additionally, everybody wants to charge you to learn what systems are in a dental practice. For the new grad, for somebody that wants to buy a practice, or somebody that's struggling in their practice, if you don't have systems in place, key systems, then you're just making stuff up as you go along. Or you're hiring someone that brings in their expertise and puts their system into your practice, which may or may not align with your vision of what your practice is. And then if they leave, it's gone. So a system is just what you do in your dental practice. It is defined ways you address important processes in your dental practice. Everything from the front office systems that look at patient acquisition and phone calls, to your scheduling system, how you deal with patients that didn't schedule, how you follow up on treatment that wasn't accepted. And in the back, you have systems of what's your appointment flow? How do you flow through appointments? What do you do? What are your setups? Those are a bit easier to understand for us doctors. But everything is a system. And what you should have is you should have it written down and thought through. And there's ways to do this. A lot of people there's some level of a system put out there for you that you can find online. And I encourage you to read them and try to figure out what's good and bad with them. You can get a consultant, and a good consultant is going to give you a good time-tested system. Some of them want you to develop the system, and it would always frustrate me, but I do understand why that exercise is there, because if the staff develops it, it means more to them, and it also can be aligned to what your vision is. But I always said if there's got to be a good way to do this, don't make me make it up. Just give me the system. The way we did some of our key systems is I had ideas of what we wanted to do, and then we did some training and talked about things. And then if you look up a TED Talk on how to make toast, or draw toast, I think is what it's called. There's a website, I think it's drawtoast.com or something. But it's a method to get people together to hash out a system that works for everybody. It's basically everybody, if you ask people to draw how to make toast, everybody will draw some different semblance of it. Some people are like, get bread, get a toaster, make toast, right? Other people get very granular, where they're like, buy land, plow the field, buy seeds, plant the wheat seeds, grow it, and they go break it down. Everybody has a different way to look at making toast. Some people, it's like, get a stick, put bread on a stick, and hold it over a fire, you got toast. And it shows us that everybody has a different way to view the system. The front office is going to view a system different than the back office is. The hygienists are going to view it differently than the doctor does, a little bit. So when you get down and everybody starts writing the steps of, say, a new patient appointment, you can then put all those steps on cue cards and put them up on a wall, and everybody can look at it and start rearranging this, and you'll find redundancies, you'll find missed areas, you'll find opportunities. And once you get that all together, you can now write it down on how we take care of our new patient flow. Everybody's bought into it. Everybody's seen the whole process and talked it through. Then you write it up as a document, and that is now your standard operating procedure, and you train on it. So that's kind of an idea of what systems are and how you can develop systems in your practice for key things. Next thing I want to talk about with the important systems is key performance indicators, and what I think is the most important system in the office. If you ever do need a system, sit down, write it out, have everybody review it or use the how to draw toast technique, and then train on it. But the one thing with systems I want to make sure you don't do, and that's called I call legislating to the exception. If something happens every now and then, you can have a system, a one-off system. Like, this is our document of one-offs and how we took care of it. So if it happens again, we can look at what we did last time. But when you create a system that for something that hardly ever happens, you just get so bureaucratic in what you're doing. So we want to kind of keep it to the key things that we need to do in our office. All right. If you have any questions, let me know.